through Facebook and YouTube. We were all doing just fine until about 3 months ago when the world was blown away by a very unwanted visitor in the form of coronavirus. Tonight we have a special program on Let's Talk About Health. And to do this with me, I hope you are all watching in, sharing, linking, liking, doing whatever you can to make this program a very big one. I have two wonderful guests with me here. And trust me, if you don't join in, you will be losing out on so much. The World Health Organization head describes the information going on about the COVID-19 as infodemic, trying to coin a new word about how there are so many facts going on, which are mostly non-facts, actually. So tonight we are going to try and look into why the black ethnic minority groups are being described as those having the worst effect of this disease. Please join me, and I'll start the show by asking my guests to introduce themselves. Gentlemen, you are all very warmly welcome to Omega Live TV.
Thank you, Winnie.
If you can just tell us your name and what you do, I'll be very pleased, and my viewers would like to know who you are as well.
Right, my name is Dr. Khan, Robert Khan. I'm a GP partner at a practice in Kent. And just a bit of background about myself before you ask. I trained in Ghana and came over here for my postgraduate training. Worked in the hospital, set up for a while, and then moved into general practice. I also I'm just the immediate past president of the Ghanaian Doctors and Dentists Association.
Oh, wow. Yeah.
And we've also been interested in doing a bit of community health education for our general population as well. So thank you for having me on tonight to discuss this important.
I feel very privileged, Dr. Khan, that you actually accepted to come on the show. Yeah, so thanks for coming once again. And
well, I'm also Emmanuel Kwesi, the chairman of Ghana Union, the Ghanaian Union in UK and Ireland. By profession, I'm in the account profession. That's what I do on a day-to-day, but for community-wide, for the past, since 2013, being the chair of the Ghanaian community here and gone through a series of other experiences that I'm sure will be useful to our viewers and those who will be listening to us.
Definitely, and that is why I couldn't wait to have you on the show with Dr. Khan. So gentlemen, you are warmly welcome. I'm sure with time the viewers are going to join us with questions, and I need them to do so. And if you are watching us, this is coming by kind courtesy of Omega Live Multimedia. They have been the backbone to this show right from day one, and it's because they believe in giving education to the public to help them, like protect themselves in terms of their health. So this is purely a health show. I mean, COVID-19 has taken the whole world by storm, and sometimes it's being politicized. But tonight, we just want to just demystify a lot of the information that is going on. So I will set the ball rolling. And Mr. Kwesi, I'll probably come to you towards the latter stages so that you come in to see how we can help the Ghanaians here. We are filming this live from Tottenham, Walthamstow, I think it is, in the UK. But I know there are so many people joining in from Ghana, actually, and across Africa. So we are getting bigger and getting better. My focus as the host, I am Mrs. Winifred Ohinikisi, and I've been doing this from the latter stages of last year in 2019. So far we have done so many topics, but this one is the big one now. So to come back post-COVID, I wanted us to discuss this and to set the line straight for people to be at ease, because I think there's a lot of nerves going on there and a lot of misinformation as well. So I think I'll set the ball rolling. I always like my viewers to have be in the know of how the disease actually is. What is COVID-19?
I think that just to give you a bit of background, I'm delighted that Emmanuel is here because this program is mainly geared towards our community. And so many people have been hearing the term BAME, blacks and ethnic minority, being more at risk. Personally, I've had people calling, speaking to me, finding out what is this disease, why am I at risk, what is wrong with a black person, why is it that everybody's talking about it, that we are more at risk than other ethnicities. Some, like you rightly said, some are fiction, some are facts. So I hope that after tonight, maybe we'll be a bit more clear.
Yeah.
That yes, it is a condition that is present at the moment that we're living with, but it's probably not how do I put it, as a disaster, probably as we make it out to be. The media hasn't helped either as well, because we live in the information age, so everybody has become kind of a media guru, trying to put information out there. Coronaviruses, in fact, the disease itself is called COVID-19. COVID, if you look at the word COVID, you see C-O-V-I-D. COVID is just the corona, and then the VI, virus, and then D for disease.
Okay.
But because it was discovered in 2019 as a new condition, that is why that 19 is attached to it. So the disease is COVID-19.
Yeah.
And then the virus that causes it is called SARS or SARS. People would see the name written SARS-CoV-. Are you with me? So
Yeah.
SARS-CoV. SARS meaning severe acute respiratory syndrome. Now the reason they call it SARS-CoV-2, you see the word 2 there, is that there has been in the past, not too long ago, another coronavirus that caused respiratory conditions. Are you with me?
Yeah.
And this behaves similarly to that one, because they all belong to the same group of coronaviruses. So because it behaves similarly to that one, even though it's a bit more deadly, then it is almost like type 2, but it's a new strain.
Okay.
Coronaviruses have been around for a while, but it was actually discovered or named in the 1960s. And it was only in 1968 that it was discovered that it actually can enter into human beings. So the human type was discovered. Now there are different groups. If you read all the evidence that is available, you would find out that normally we say that they fall into what we call 4 different subgroups: alpha, beta, delta, and gamma. Now, in the majority of cases, they cause diseases in animals, or they reside in animals, but a few have made a jump to human beings. Are you with me?
Yeah.
Typically, there are 7 types that infect human beings. I mean, for the sake of our listening public, I can't go into the technicalities of it.
Yeah.
Of these 7 types, 4 of them commonly cause the common cold, pneumonia, and whatever. Viewers may have heard a few years ago, we heard about this, avian flu, if you remember, that we were even injecting people about for. And then there's also been what we call the swine flu, if viewers would remember. We've also had bovine flu. Bovine means cattle, swine means pigs, avian means birds. So the virus actually resides in animals. Birds, turkeys, chicken, fowl, poultry, in some pigs, in some cattle. So it's always been there. In 2009, the SARS epidemic that happened was said to have originated from bats. Okay, now whenever you talk about viruses or some of these conditions, there's something we call reservoir. A reservoir is like a container or a habitat for an organism to dwell in. So in this case, you would say that the organisms or the coronavirus normally dwell in animals, so animals are the reservoir. Some viruses dwell in animals. Now and again, they may make a transition and then infect humans. In the majority of cases, our immune system is able to deal with it. In some cases, then it becomes an epidemic, like we have, because then the virus changes and becomes more deadly than it should. 3 of them have made that transition. Viewers may not be aware, but not too long ago, there was one called the Mediterranean, MERS, COVID disease. That happened in somewhere in the Middle East, so Middle Eastern respiratory syndrome. And then, as I said, we had the SARS epidemic as well, 2009. And then this is the 3rd one. All 3 of them were types of coronaviruses that became virulent. This one is a new strain, which means that we've not encountered it before, but it's still a coronavirus. Why did they call it corona? Corona means crown. So if you look at it under the microscope, you would see that, like many people have seen on their TV, it has all these like spikes sticking out. That is why it's so corona, like a crown, a virus that looks like a crown. So just to sum it up, the disease is COVID-19. The virus is SARS-CoV-2. Yeah.
Well, wonderful. If you haven't tuned in yet, you must be missing a lot. And this is not the kind of information you want to keep to yourself. You want to share to your friends, like our page. We are in the middle of getting some sponsorship, but it depends on how many people are viewing our show. So I will entreat all of you watching to share it, like our page, and just bring your questions as well, because later on I will be taking questions at some point. So we've looked at how does it actually attack the body. We know it dwells in the organisms, isn't it? Why has it been so special? Because it's not new, like you've just said. So what happened this time? How does it attack the body?
Okay, let me give you a typical scenario. Everybody knows malaria, isn't it? Malaria is the commonest example.
Probably those who are in Africa, they would know malaria, because I do have guests who are viewers who are watching from other areas, and trust me, like from experience, I know sometimes people don't know what happens like next door, let alone what happens in Africa.
Agreed.
So yeah.
So I used the word reservoir. A lot of bacteria or viruses have hosts they live in. Okay, I mentioned bats, cattle, fowl, poultry. These are things that we eat, don't we? So if you eat these organisms, then even though we expect that once you've eaten something, the acid in the body will deal with it. Anything strange, the body's immune system can deal with it. Some organisms are very clever. They get into the body, they can adapt. It depends on how they enter the body, actually. Now, if this organism was said to reside in bats, because where the initial cases were discovered in Wuhan, in China, there were people that were, how do I describe it? They were known to use this wet market. The wet markets are markets where they sell all kinds of animals. And sometimes when you look at some of the images we've seen on TV, some of the newscasts, you would see that huge market. Imagine maybe say Makola or Kegitia or meat market. And then you have several tables with all kinds of wildlife.
Yeah, these are big markets in Ghana, so
so people can identify with it. So you have all kinds of wildlife, basically. Some of them raw, some probably roasted, cooked. I don't know how they prepare them. Mixed up. Some of the evidence that I was reading were that, I mean, if for example, if you've got the carcass of a dog, the carcass of a bat, the carcass of, say, a pig, fowls, whatever, all lined up, mixed up on a table, then you're going to have a situation where things are going to jump from one organism to another. Now, human beings eat this. You may not eat bat, but over there, it's
a delicacy.
It's a delicacy. So the assumption is that because it's found in bat, the only way that it entered human beings probably was because people started eating it. However, there's still evidence being gathered. In normal situations, you wouldn't expect it, that even if it's eaten, the body should be able to deal with it. Why it was so virulent, it is said that probably it mutated or changed in a way that it became very virulent. Once it entered maybe the first case or the first few cases, then they also started then transmitting from human to human. So first you have the animal to human transmission, and then it became human to human transmission. And then it took off from there. But originally, it is said that it originated from Wuhan in China. And as people traveled out, they took the virus with them.
I'm sure we'll come to the signs and symptoms.
That's right.
But I'm assuming, like, I'm here, I've been attacked, just attacked. What does it do in the body? What does it actually do in the human body for it to,
You have to understand how viruses work. Viruses like bacteria work almost the same way, but actually in different ways. The human body is made up of what we call cells. So if you take any part of the body, a cell, what can I use an example of a cell? You know pear? You know pear, pear that we eat.
The pear fruit.
The pear fruit. If you cut the pear, you've got the fruit inside and then the nut inside.
Yeah.
A cell, I can liken a cell to that. So this, the nut inside is what we call the nucleus, and then the fruit is what you call the cytoplasm, or maybe the liquid surrounding the nucleus.
Yeah.
The nucleus is actually like the capital town, where all the main activities happen. That is where the DNA or maybe the control center of that particular cell is. Now, the virus is clever. It enters, and we'll come to that, it enters the human body, usually, as we said, through what we call droplet infection. So somebody coughs it out, somebody sneezes it out, it lands on surfaces, it hangs in the air, another person comes into contact with it, and then it enters the body through the airway, basically. And what it does is that it attaches, it has a way of entering into the cell, it goes into the cell. And like most viruses do, they don't stay in the green part of the pear, they go into the nucleus. Once it goes into the nucleus, the virus must survive. And viruses are clever, especially the very deadly ones. Goes into the nucleus and it uses the DNA. It uses the factory that maybe the body uses to manufacture its own cells and uses it to replicate or multiply itself. Now, the more virus you have in the body, the more severe your symptoms are going to be. Again, if, for example, as we'll come to it later on, if maybe your general state of health is not good enough, then even a small dose of the virus can be quite virulent. If your state of health is quite good, then you might even be exposed to a bigger dose of the virus and you'll be able to fight it. So that is how it operates. It enters the body, infects the cell, uses the cell's own mechanism to multiply itself, and then overwhelms the whole system.
Yeah, that's actually very important to know because that's the whole point of having this show, that people understand their condition. And when we come to deal with like why it is attacking black and ethnic minorities, is because from my experience as a nurse, I know a lot of people don't have an understanding into their condition, whatever they are diagnosed with. They do not take time to learn about the condition, know why and how it attacks the body. And I mean, I believe if you know that, that is the first step to your treatment. If you know how it attacks your body and what effect it has on your body, then you are halfway there as part of the treatment. So yeah, I think that is very good. And for those of you who have been following these series, you remember we did HIV/AIDS, and it's the same. It's also a virus, and what that did was it just took over the immune system, attacked it, used it as a factory. So that's just recapping, because that's a virus as well. Used this as a factory, and then it replicated itself, so breaks down the immune system. So it is a similar, pretty much the same thing going on. Yeah, so now you know how it works. Did you want to say anything, Doctor?
You see, the difficulty with viruses is that, you know, the nucleus that I talked about, or the hard nut in the pear. This is where the control of the cell is. Why viruses are so difficult to treat is that if you want to get to the virus, you have to get into the nucleus. So if you're going to put a medication inside the nucleus, you could end up damaging the whole cell and killing off the individual. So it makes it very difficult to treat viral conditions. Whereas with the bacteria mostly usually would not go inside the nucleus. So antibiotics are able to attack them in the cytoplasm or the green bed of that pear. If you understand what I'm saying. That's right. So you would also say that most epidemics, or the deadly ones, have been viral and usually not bacterial.
And that will set the scene beautifully, because obviously when we come, people will want to know why do we wash our hands and that. And with this beautiful description, we know that whatever you are using is attacking, going in all through, isn't it? To break and get into the shell and all that to kill the virus. So it's very important. So that's a very, very good description. So is it a virus or is it a bacteria? Because there was some publications, some news that came up, apparently some autopsies were done on those who died in Italy. And they said, oh no, it's not a virus anymore, it is a bacteria. What is it really?
It is a virus.
It is a virus.
At least as a medic, from all the evidence that I've read so far, unless maybe there's new information that comes out there that it's actually a bacteria. I think where the confusion was that, you remember when the symptoms started, was said that if you have a cough, if you have a fever, if you have a chest pain, if you have difficulty breathing, those were the classical symptoms we were given. And because we know that generally coronaviruses tend to attack the airway, the respiratory system, I think the world thought, well, from the initial cases that were coming out, we thought it was mainly a respiratory disease because people were needing ventilators. Then as autopsies were being done, patients were noted to have developed huge clots, what we call embolus or thrombus, are you with me?
Yeah.
In the body. So then, and they were also developing what we call multi-organ failure. So the liver packs up, the heart packs up, other organs in the body packs up as well. And it gave a picture of what we call disseminated intravascular coagulation, DIC. Now, you tend to see that with bacterial diseases and sepsis. And sepsis is part of what this organism does. So it is a virus that doesn't just attack the airway, it attacks multiple organs in the body. And it gives you a picture almost as if it's a bacteria, it's a virus, but it is a virus.
Yeah, but it is a virus, so we all know it is definitely a virus and not a bacteria. I think that is quite clear. Until we get new evidence to suggest otherwise. It's definitely a virus and not a bacteria. So that brings us, because you were mentioning a few things, what signs and symptoms, because I have seen so many. Practically, I've seen so many. What signs and symptoms should...
The list goes on and on and on. It's becoming as long as my arm. I think one of the... Still on TV, when you see the advert, if you have a cough, if you have a fever more than 38 degrees, if you have shortness of breath, okay, those are 3 classical symptoms that started in the initial stages. And then it was noted that there were people who were not presenting with a cough or with a temperature, but they had chills. It gives you the impression of a flu-like illness because it causes a flu-like disease. And so you would have the headache. And the headache is one of the classical things that a lot of patients complain. This persistent headache that is not stopping. You're taking paracetamol, it's still there. Day 1, day 2, and then people will know that they start feeling shivery. In a place like Ghana, the first thing that comes to mind, people will say malaria. I've got malaria, but it may not be malaria, even though you don't have a cough. Evidence shows that in 50% of cases, there is no cough. So we cannot use the cough as the only marker of the disease. So in terms of the symptoms to look out for, a cough is number 1, temperature, number 2, chills, you start shivering, you feel as if you have a cold, you're shaking, the headache is one of them. And then generalized body pains, muscle aches, joint pain as well. Some patients may feel very dizzy. And then lately, we added loss of appetite and loss of smell. The loss of smell is so significant that you can't smell anything at all. And that loss of smell can persist
for months.
It can persist for months. It doesn't just end after a week. And then as the disease progresses, then people start feeling tightness in the chest and feeling difficulty breathing. It depends on what other diseases the person has. They may have different symptoms as well, but these are the main ones. And then later on, it was reported, you remember we were talking about the COVID feed. It was noted, I think this research was done in Spain by the Spanish Dermatology Society. They did a trial in about 375 patients, and they noted that quite a number of the patients that were presenting with COVID had rash, and they grouped that rash into 5 different kinds of rashes. Some of them look like hives, you know, hives like wheels. You know, when, like nettle rash, some people call it nettle rash, when you've been in contact with a plant or something that you're allergic to, you start developing wheals on the body. A few of them look like rotten skin. Quite a few of them look like chilblains. I mean, chilblains is not something common in Africa, but here, during the cold weather, people will know that the tips of the fingers and the toes, they get very painful and red and looks bluish. Interestingly, some COVID patients displayed those symptoms, but that is not surprising because you're dealing with the circulation, and the organism attacks the circulation as well. And there was also another type called the vesicular rash. It was almost like chicken pox like. So you have little blisters on the body, mainly on the torso. if you Google, for example, COVID rash or COVID feet, you would see all these
beautiful pictures,
all these beautiful images that are there.
So not exactly beautiful, but they are.
That's right, and we tend to use the word beautiful to describe nice images. So all these symptoms are there. So it gives quite a broad picture. I think the advice I tend to give patients is that if you feel unwell, especially during this pandemic, don't just assume that I've just got an eczema, or I've just got chickenpox, or I've just got measles. It is always better to have a checkup. Don't take it for granted. As I said, not everybody gets a cough. Some people's presentation are very, very weird, and then suddenly they crash. And then they need intensive care. And then when you speak to relatives, what the relatives will say is, oh, he was fine, she was fine. Well, the only thing he complained was that, oh, he felt a bit fluid a few days ago, and then he recovered, and suddenly it became quite acute.
So before, I think at this stage I'll probably let us look into the impact of the black ethnic minority groups, and that is where I really desperately needed Mr. Kwesi to join in. So viewers, please take time to assimilate the information at this stage, because we're going to get into like treatment options and what to do and try and break down all the myths and everything. So Mr. Kwesi, my worry sometimes is how and where people can get help, and especially in a pandemic like this, and especially with lockdown coming in, I believe people would have been helpless and would have needed some sort of help. Can you tell us like what Ghana Union is about, and then how you were involved with COVID in the UK?
The Ghana Union is an umbrella body for well over 50 to 100 groups across London and its suburban environment. We have personnel, one of which, Mr. Dr. Khan is here, including yourself, who belong to one of the groups, and many other professional bodies. Now, the union operates on a charitable basis, so we generate funds ourselves. We don't have any specific funding from any government, be it UK or Ghana government. We are not an arm of the High Commission, as most people perceive it to be. So we tend to be the voice of the community, work with the High Commission, advocate for Ghanaians, and on matters that we believe we have to intervene on case-by-case basis, we do help. We tend to work with the groups because a lot of the people that we have here, especially the Ghanaian community, they tend to come and they want to belong to their own kind of ethnic community from wherever they've come from Ghana. Much of the Nigerian also do the same. And Sierra Leonean, we've got Sierra Leonean community, we've got Nigerian community, and it tends to be the Yorubas who group together, the Igbos who group together. So it's Ghanaians. You've got the Evers moving and meeting at one place, the Fantis together at one place, and then you've got the professional bodies like the doctors and dentists, the nurses association, the lawyers, the social workers association. So we tap into all these groups for the needs of the people, community needs. When it comes to matters affecting individuals, people have issues with housing, so we have a broad range of solicitors that will direct them to. People have issues with obviously regularizing themselves here. Again, we deal with them. We help to signpost them to the right sources. On health grants, we do tend to consult the professionals on the field so that they can give an advice. Because a number of our people, we tend to be we keep things to ourselves.
That's right. Yeah.
This is one of our biggest problems. This situation that has come upon the world, the question is why, when it started, the irony is we thought, as for this disease, it's not for the black people.
Exactly. That's
but
one of the big myths.
After 3 months, everywhere you go, it's the black and ethnic minority community that are more affected. One, because we are the one mostly that, especially talking of this country and most parts of the world, we tend to be on the middle to low income type of jobs, right? And that is where you'll be touching surfaces, you'll be traveling on the packed buses and the trains in the morning, and by the time you finish your day, you are affected. bus drivers. We've lost a lot of people, you know, a number of them.
Drivers, yeah,
People in the health profession who are, you know, in the lower level of health profession and not mostly office-based have also been affected.
Yeah.
We have people who, through their day-to-day job, just basically in the cleaning services sections, you know, and is that's one of the reasons why we are mostly affected. The other bit, which I'm sure Dr. Khan probably will agree, is that the way we look after ourselves.
Yeah.
We have prioritized, we come here and we prioritize everything else other than our health.
Yeah.
We, like Dr. Khan said, when you see persistent coughing or headache that hasn't gone away for 3 days, we will still go and do our 2-hour job. We will still go to the funeral that somebody's doing. It's that kind of priorities.
Yeah. Not getting our priorities right.
Exactly. And we tend to think, oh, as for this one, you know, it will go away.
Yeah.
And then before you realize, you know, you've been taken away. So yes, the union itself is a body, but at the same time, it's connected to a number of other sub-bodies that operate together. And the way we do so, because it makes it more personal. You can approach your person that knows you well, understand you, you can confide more in them than going to somebody that you have never met to tell your story. Culturally, that's not the way we are. And so dealing with the groups and them belonging in their own groups is much easier to mobilize them from that basis. And that is what the union has been doing. And it's been in existence for 40 years.
Oh, wow.
It's
That's
not
a
a
long
union
time.
that started yesterday.
Yeah, I asked that question because when I posted the flyer for this show and said you were the chairman for UK and Ireland, Ghana Union, a few minutes after I had a message, and the message was, where is this based? I've never heard about that. and I thought that's the more reason why it's very important.
It's quite
to come on.
understandable. But the question is, how many of the people that will ask the question themselves have availed themselves to be part of the community? It's okay, I mean, ask saying that you haven't heard about it. But some people have lived here, trust me, 20 years. They've never belonged anywhere. The only time we find ourselves wanting is when we are in trouble or when we need help. That is the time we start asking. Right? So some people will come here and say, as for me, I don't want to get into anyone's business. I'll just go about my own business. But there's always one day you're going to need somebody. So until you get out there and get involved in what is going on in the community, it's like being in a church and not wanting to attend any of the other programs other than Sunday service or being in the mosque and just going there for Friday and not doing anything. You know?
So what were the practical challenges? Did the union actually have any challenges practically? Like with people, were you involved in anything to help?
We've been involved. I mean, when the lockdown started in the middle of March, I would say 21st of March, we had elderly people. Some of them were in their 70 plus. Obviously, they were the first that took the advice to stay home, isolate. Before the official line came that we must all stay home, they were told to keep away from crowded areas, and we have people who are either living by themselves, they've got children who have grown and moved out and they're not living with them. Some also are not in a good health state for them to do things for themselves. So what we did was Ghana Union and its partner organization called Miss Ghana UK Foundation. We did something called the help card. What simply means is if you need anything, if it's a matter of wanting to talk to somebody, if it's a question of I want to get a few supplies from the Tesco, because you realize that the queues were getting longer and longer and longer, and most people couldn't even attend to that. So we tried our best, and what we did was to go around or ask those who need help. They will phone up and give a list. I mean, I have a lot of text messages of deliveries that I have personally driven, gone and done the shopping and delivered. And we've taken care of, in terms of supporting those in that category, almost 39 people so far.
Really?
Yes.
And are these Ghanaians?
Predominantly Ghanaians, because they know you as a Ghana Union, so it's much easier for them to come to you. But obviously, if there was a Nigerian who were to call me and said, I need help, he wouldn't be turned away, because at the end of the day, we are all in the same community. And the purpose doesn't matter who he serves, as long as we serve one purpose or the other. So yes, most of the support we've given were Ghanaians. They will
Okay.
just send you a list, Mr. Quason or some of the members of the team will go and deliver. So what we did was we took care of certain areas, geographical areas in London. So I'm mostly southeast and the south. We had another group of people within the Miss Ghana team who were north and northeast, northwest and the rest. So it depends on where the demand will come. We tend to share it among ourselves.
Okay, yeah, so that was a very good thing you did, because sometimes people are in desperate situations and they don't know where or how
I recall the Easter weekend. That was when the pandemic, the lockdown has taken effect less than I would say a week and a half or so.
Yeah.
And there was this man in Croydon, and in the end I delivered shopping on the Friday, on Thursday prior to the Good Friday, and you can tell the relief on his face, because the lockdown came when he wasn't really prepared and there was nobody around him. And I was actually personally glad I was able to do it before the Easter, because I was thinking on my way back driving from his house, I was thinking if I didn't get that to him, what would have happened over the weekend? Because it's Easter weekend. He has nothing at home, and what would have happened? So these are the small things we can do to help.
And how do you generate funds to be able to do all this?
Well, like I said, most of our fundraising activities have been just normal activities like dinner dances and other help from groups who are affiliated to us, paying dues. We do also have a means of claiming gift aid from the HMRC on donations that people make to us. But apart from that, we don't have any. We are, like I said, we are non-governmental entity. We don't wait for anyone to say at the end of the month, this is what you get. No, we have to keep going, and that is what we've done for the past.
It will probably be a good idea, maybe probably to pass your number, or your union's details.
I think my number is all over the place. Anybody that wants to obviously get in touch with us can go on to ghanaunion.org.uk, and all the information is there. The ghanaunion.org.uk, all the information is there.
Fantastic. So if you are just joining us, we are streaming live Let's Talk About Health on Facebook and on YouTube. And my guests have got Dr. Khan, Dr. Robert Khan with me, and Mr. Emmanuel Quason from the Ghana Union. And we are trying to look into the COVID-19 and its impact on the Black ethnic minority groups. So please do well to share, bring in your questions. That's more important to me than anything else, that you actually bring the relevant questions so that they can address it while we are on the show. So at the moment I'm in on the page, on our page, and I'll be looking at your questions so I can let the panel address it for us. So I think we'll probably go back to practical or
but before you do, I think we need to also look at the fact that, look, this pandemic, apart from the union doing it to help certain specific people, it has also brought a number of difficulties. The impact is varied depending on who you talk to and how you analyze the situation. But it has an economic impact on all of us. It's brought some social impact on us and health impact. So it's like, when you look at it from the wider perspective, there's never any single person within our community that will turn around and say, as for me, I've never been affected. It's either affected you economically, in terms of job, in terms of your cost of living. Some people easily think that being at home, working from home means you are not spending a lot. Of course you do. Because you may have children who are now not going to school, they are home, and the electricity is on, the gas is on, they are playing their game. You can't sit around and say, because I haven't been paid or I don't have a job, and you can, so basically every one of us as a community has one way or the other been impacted. And hopefully we can explore that a bit more.
We can explore that a bit more, certainly, And so we'll carry on, Dr. Khan, and we want to look at the treatment options. I think we've started by going through what the virus is, how it looks like, where it came from, and all that. And we know how it actually attacks the body as well. So I think we've touched on the signs and symptoms as well. But the most important thing for people to know that you need to know yourself as a person and your state of health. That's the most important thing, because the symptoms are so varied. and people are having all sorts of symptoms happening to their body. And just so we know, at some point we'll probably touch more on why there is no need to stigmatize at all when it comes to this disease, because I mean, I work with colleagues who have never had any symptoms and had gone to do the tests just for trial, you know, the trials going on, and just to check whether they had antibodies, and if not, to have the trial for the vaccines that are going on, and they've come up positive. Meaning at one stage they had actually had an encounter with the virus and had dealt with it without even knowing that they've had it. So now we know the signs and symptoms. Can we look at the treatment options? What was happening? The treatment options.
Before I come to that, there's something I see. People keep hearing 2 meter distance. Now it's become 1 meter plus, isn't it? There's a reason for this 2 meters or 6 feet distance. Then when people cough, what they don't realize is that anytime you cough or you sneeze, you release something called droplets. Droplets are like little tiny fluids that just gets into the atmosphere. There was a lot of evidence that showed that the droplets, some of the droplets could hang in the air for up to 8 hours. Yes.
8 hours.
For up to 8 hours. So this 2 meter distance we're talking about, if I should sneeze now, it is a reasonable distance which would allow my droplets to fall down to the ground and not directly in your face. So if we were quite close, that means that if I cough or I sneeze or I splutter, then you're likely, if I have harboring the virus, then I pass it on to you. That's why unknowingly many people got the virus, like you rightly said. Some people did not have any symptoms at all, and yet they were positive. Now I had the virus and I was down quite severely with it for about 2 weeks. Despite all the hand washing I was doing, using PPE at work and all that. So it tells you how versatile this organism is. So people should not take it for granted when we even talk about social distance, because it is that deadly when we talk about washing of hands. Simply because, I mean, as we were sitting here, unconsciously, I don't know how many times my hand has gone to my face.
Exactly.
In clinic, whilst I'm doing clinic, even with a mask on, so many times my hand touches the glasses and it touches the mask, it touches the glasses, touches that. Unconsciously, it's an unconscious act. So this virus can stay on surfaces for up to 72 hours, as we know. So assuming that maybe you go to the supermarket, you know, when the condition started, I stood at one of my local Asda's, and I was just making an observation. And I noted that despite all the warning, people could pick up shopping baskets, shopping trolleys, whatever. In one case, somebody had just coughed into the hand and they just held the trolley, you know, the handlebar. Now my question is, how many people wipe the handlebar? Or how many people would even wash their hands once they come back and sit in their car, or wipe their hands?
It's interesting you said that, because doctor, this phone that we carry,
that's the
we are wearing the gloves, we are wearing wherever the mask, but our hand is constantly on the phone. And that's the only thing that we don't even sanitize, or we don't even have any means to
people don't sanitize.
Take the things out of it. So you ask yourself, you wear these gloves, you go out there, you go for your shopping, you've done all the things. The next minute you come back, you got WhatsApp message, you're checking, and then a phone call comes, and then it's on your ear.
As soon as you sit,
so really and truly.
As soon as you sit in the car, you pick the phone. Just when you just enter the shopping center, without sanitizing your hands. So it's so difficult to do so. But it is equally important for people to remember the basic things. Keeping the distance, washing of the hands, to me, is even more important than wearing a mask. Are you with me? So washing the hands, anytime you touch surfaces, wash the hands before you eat, because your hand automatically goes to your face all the time.
And is that why we are being encouraged to wear the mask?
To wear the mask, that's the reason, because when you wear the mask, it's covering the nose and the mouth, which are what we call the portals of entry for the virus. So essentially you're protecting the nose and the mouth.
So it is not like it's sieving anything. I remember when the whole thing started. Obviously, again, from my nursing point of view, and from our experience at work with using masks, when they started making all those fancy
Some of them are beautiful.
They are beautiful. Now they become like a fashion statement,
It is
isn't
a
it?
fashion statement,
Yeah,
yes.
and you know, Africans, we do the most.
Yeah.
But I remember coming on Facebook and I was so terribly concerned. I thought, listen, guys, this is not going to save anything from entering you. But so why is that? What changed? And that it's suddenly okay for us not to exactly be using the medical kind of masks, but these, makeshift masks are okay.
No, at the beginning of the pandemic, we're still gathering information.
Yeah.
When you don't know so much about a disease, that you have to do whatever it takes to protect yourself. Initially, there were specified, apart from, in hospital, yes, we need specified surgical masks to use.
Yeah.
Because we are in direct contact with patients, and some of the procedures certainly that we perform means that we need certain specific surgical masks.
Yeah.
In the majority of cases, people have been encouraged to wear the mask, but it is known that it is not as if it is sieving out, like you said, sieving out the virus, so wear it.
Yeah.
It is mainly to prevent that contact of the hands to the nose and to the mouth, which unconsciously we do. Now, just quickly to mention some of the risk factors, and because when I come to explaining why we are more at risk, you would understand that age. So when you look at the statistics from Spain, from Italy, from China, from all around the world, you would see that even within the BAMI community, a great majority are older.
Yeah.
So initially they said that, it doesn't affect children, it affects those that are old, until they realize that any age could catch it. But in the great majority, it is those, the older you are, the more at risk you are. And that's understandable, because the older you are, the more diseases you're likely to have, the less your immune system
will hold up.
Yes, can cope. If you encounter this virus that can overwhelm your immune system. Again, people with comorbidities, multiple health conditions. It was noted that if you had type 2 diabetes,
so we are looking into
the risk factors. What is it that makes somebody more prone to the condition than another person? Because you would have two people living in the same household. One would get it, the other one would not get it. It depends on several factors. How much of the virus they've been exposed to, which means what kind of job do they do really? What kind of diseases are they already carrying? How fit they are, and the kind of immune system they have. So if I have type 2 diabetes, but I'm reasonably fit, I may be able to fight it off. But if I have type 2 diabetes with high blood pressure, I have two conditions.
That's the comorbidities.
Several conditions existing at the same time. So I would have not just diabetes. Diabetes itself affects your immunity anyway in a big way. Then you have hypertension, which a great many of our people don't manage well. And I'll come to that at the tail end of it when we talk about what can we ourselves do to improve our own health and fitness. And then if you have something like a heart attack or heart conditions, and something interesting, obesity, being overweight. And I know how we all struggle to shift the weight off, but we can't use that as an excuse anymore, because obesity is one of the, if you look at a lot of the cancers that are caused, almost every time you will see obesity rear its head there. So it's a condition that, personally to me, one of the most important things that we must do something about. Just putting on the weight for no reason at all. Yes, I know some of us, we drink water and we still put on weight. But in the great majority of cases, most of us, it is just diet and lifestyle that has led to that. The more obese you are, the more at risk you are.
And the funny thing is, in Africa, the bigger you are, the better you look. It's so wrong, isn't it? It's like sign of good living.
Right. If you have a fat pad at the back of your head as a man, and you have a very big punch.
Sign of good living.
That's right, a very big tummy to show that it means that yes, you're living very well, but you're not living well actually.
Oh dear. Anyway, at this stage, I'll just. Are you?
No, I was just going to say the treatment. So these are the risk factors, and the way that the virus is transmitted. In terms of treatment, I would probably not go into detail. Are you with me? In the sense that every case is unique. the treatment that you're given at the hospital, okay, it would depend on exactly the condition you came in with. Because not everybody requires a ventilator. Not everybody would require an antibiotic. Not everybody would need an antiviral. There's an explosion of so many things.
Yeah, I think
online.
before we go that, I want to acknowledge the presence of some of the people who are viewing.
Okay.
I have Ekia Dansua watching, Justina Stevens, Nana Sarah Amufa is watching from Cambridge, Ima Sikeni, he is saying, Mr. Quayson, where is the union located?
All right.
He wants to find out, so we'll come to that. I think we'll bring that up before we finish the show. And there is a lady called Ama Brehene. You know her. She says the Ghanaian Methodist Fellowship Choir undertook a humanitarian task donating groceries to members in London and around outskirts of London. Recipients were appreciative. Very satisfying task when achieved. Continue to watch the show. Thanks.
And it's right that I might highlight that a lot of the community organizations have either done similar initiatives for their members. I know of some of them. I don't want to name some and leave the others, but I know that a number of the organizations, including the GMF, GNA, and others, have done a huge, some to have even waived their dues as a support mechanism for their members, especially most of those who are elderly. So I just want to use it as a medium to thank all the groups for the work they've done, bringing the community together and supporting those within their groups. That's what we need. In times like this, we need to lean on each other.
Okay, and we'll carry on with those watching. Stephen Tufor is watching. I think he's one of our presenters here. Dr. Sapir, she says very educative program. Veronica Abner Ansa, good job, big bro, Mr. Quayson. Cynthia Atto, great job, Chairman. So a lot of them are acknowledging you. Veronica Abner Ansa, thank you, Dr. Khan. Very educative. And Rachel Amankwa, we love it. Keep sharing. That's the main thing. I need sponsors for this show because I need people who are ready to come on the show. But so far my guests have been willing to come and support the work I've started doing with this show. But there are organizations out there who want to happily come in, but they want to see how much the show is patronized, and then they will join in. So tonight I am on a different wavelength altogether. I need you guys to share, like, post, do whatever you can, and let's bring this health education program, let's take it to a different level. Providence Grace Ajaman Ivanulov, she's a presenter here at Omega Live, she's watching. My very own big sister AC Hammond is watching. She's always behind me actually. Thanks sis. Christina Kumsin is watching. Nana Sarah Mufa is saying, I think this is a question probably for Dr. Khan. A lot of the men who recover from the virus start having strokes, liver problems, or suffer from erectile dysfunction. How is it related? That's a very, I know she works in the hospital, you see, so that's the only reason, because this is like deep. This is complications as a result of COVID-19. And I think she knows that because she works at the same hospital I work in, and we had a staff who was badly affected by this, and has thankfully recovered after about 3 months in intensive care. And he's made it. That just brought shivers down my spine because he was really knocking on the door of death, really. So if we can go to her question, Nana, you want to know why people who have recovered from the disease, suffering with strokes, liver problems, erectile dysfunction, and the lot, what could possibly be going on?
I think basically, remember I said that this virus also attacks the circulatory system. It attacks it, and it attacks the cells. There was one particular research that I read that suggested that the virus actually attacks the red blood cells in the body. You know, a lot of people were being put on ventilators, and once the person would complain, I have chest pain, I can't breathe. When you measure their oxygen level, the oxygen levels are quite low. They appear to be desaturating, or the levels are going low. When they hit the hospital, one of the first things we do is start giving oxygen. We put them on ventilators. Later on, it turned out that you're putting the oxygen in, but the red blood cells are breaking down. But the virus is so clever, it enters the red blood cells, and then it takes hold of what we call the heme component of the red blood cells, and then uses it on its own. Now, this was then explained that if you have cells breaking down, then cells are going to clump up together. And that explains the thrombosis that was happening as well. So it was causing clots in the blood. Now think about it this way. Stroke, for example, is caused usually two main mechanisms. Either a blood vessel tears in the brain, or a blood clot lodges in a small vessel in the brain, denying that portion of brain blood supply. So if somebody has developed COVID and they probably developed clots in the circulation, then if any of the clots lodge up in the lungs, they will develop what we call pulmonary embolism, or clots in the lung, which was seen in some patients on autopsy, and will also develop clots in the brain, which then would lead to stroke. If the person is fortunate, they will recover. In much the same vein, remember that erection, for the penis to enlarge, blood has to get into it. Are you with me? Now, the penis is supplied by what we call micro vessels, or smaller vessels. Smaller vessels. Even if the veins are blocked with clots, then definitely it will affect the mechanism. Now, the overwhelming nature of the condition itself, even after people have recovered, they have to understand that you're not suddenly going to gain your strength back immediately. So definitely, a part of your erectile function will be affected. It is not strange. This condition causes multi-organ failure. It attacks so many different organs, including the liver, and the kidney, and the heart, and the brain, and the circulatory system. So it is easily explained. If somebody develops a stroke, a liver condition, or the kidney packs up, develops what we call an acute kidney injury, or renal failure as a result of it, because of the disease as well.
So I think this is the stage where I probably will come in. Why is this attacking us as blacks so much? What is going on? What is so different about us that is making us so predisposed to this disease?
Let me demystify this. I don't think there's something wrong with our biological makeup, or our genetic makeup. It is an interplay of several factors. It is true that we're more at risk. Look at it this way. In China, where so many people died, did you hear of statistics that it affected mainly ethnic minorities?
No.
In Spain, did you hear that?
No.
In Italy, did you hear that? You hear that in the UK and in the US. And it's mainly main cities where you have immigrant population. A great majority of them in forward-facing roles. Forward-facing roles, we're saying that people whose job involve meeting people all the time. Are you with me? So if you come to a big city like London, where the cases are high, or you go to Birmingham, or you go to, say, Liverpool or Manchester, a great majority of the people who are doing most of the roles in the community are from the blacks and minority ethnicity, which include blacks, Asians, Bangladeshis, you name it. Are you with me? Now, if the majority of these people are the ones that are bus drivers, work in retail, work in healthcare sector, they work as carers, they work in security, they work in jobs where they are required to interact with patients, people all the time, then it makes sense that in a day, I'm not going to be exposed to one person that is sneezing at Victoria train station. Everybody that is passing through without a mask is coughing, is sneezing, sometimes even shedding the virus, coughing in their hands, touching whatever. Unfortunately, majority of our people are maybe doing cleaning, working in the hotel sector, working in the hospitality sector. Look at the number of doctors and nurses and healthcare workers who died. Majority of them. So even when you talk about socio-economic status, why is it that doctors are dying, as well as cleaners that are dying from the same BAME background? It probably has nothing to do with the fact that one is rich and one is poor. It is simply because they are all exposed to it. In the countries where people died, again, it is exposure. The more you are exposed to it, the more likely your immune system will be overwhelmed with it. And this then lends credence to the fact that you maintain the distance, you stay at home. So then your encounter with the virus is diminished. Are you with me? So it is not because we are genetically inferior, if I'm allowed to use that word, or biologically. Unfortunately, then you look at health comorbidities. blacks and minority ethnicities tend to also, we're more at risk of developing hypertension, type 2 diabetes, because of our genetic makeup, more likely to put on weight. And then a great majority, like Emmanuel said, most of our people, what jobs do they do? How much do they earn? Socioeconomic factors. They don't earn much. Many of them have to juggle 2 or 3 jobs. So maybe he works as a carer in the morning, and then at night works as a bus driver or does something. 3 forward-facing roles, high risk. I remember somebody telling me that even during the height of the pandemic, when their Caucasian colleagues were not taking up overtime, a lot of our people were taking overtime in hospitals, cashing in because it was double rate. Now my question is, how much do you need to risk your life that much? Okay. Unfortunately, people have to do 2 or 3 jobs to be able to manage the rent. Then you talk about overcrowding. Okay, these are all factors that were listed in this what do you call it, publication from the government. Okay, behind the data publication that they published, looking into the risk, that's why we are more at risk. And these are some of the findings. Overcrowding. Why overcrowding? We come from extended families. And when you go to a particular home, sometimes you might see 2, 3 generations. Grandma is there, grandpa is there, parents are there, and the children are there. Sometimes we do have big families. Occasionally, you have a group of people living together because one person cannot afford the rent. So then they come together with colleagues, 4 or 5 people sharing the same apartment, again overcrowding. And the virus has proved that the closer you are, the greater the transmission. Because you can't social distance when there's a lot of you crowded in the smallest space.
And we'll come into that with Mr. Quayson.
That's right, with Mr. Quayson.
So that you look at what is happening in Ghana for us. But can I just acknowledge a few people who are still tuned in? Claudia George is watching. She's in Ghana. Irene AB is watching. Irene was one of my resource persons who was dealt with occupational health. Justina Stevens is watching. She says, nice one. Gifty Edu, you are watching. Thank you. And Ima Sikeni, or I'm not sure whether it's Emma or Ima, but she says, excellent education. Marian Otu of Iran is watching. Thank you, Dr. Khan. It's EAT Saki. I think that person was in Takrady, I'm sure. Yeah, a pastor.
That's my brother-in-law.
Is it?
Yes.
I see. He is watching from Ghana.
Wonderful.
Oh, wow. Yeah, I know him actually.
Yes.
Yeah, and Elsie Ajete is watching.
That's the wife.
Ajia too. I see. Bangura is watching. Oh, wow. Ellis Bonnie Andrews, Alberta Awache. She was a resource person here who looked into safeguarding. I'll get you back here very soon, Alberta. Thank you so much. Emmanuel Okomensa, Claude Turner, Iradra Gabra is one of our presenters here as well on the SCSC. Irabna, you were supposed to be here. Yeah, anyway, stay tuned in. Aliyah Berlin, Stuart Soa is watching. Stuart is watching from Martinique. I don't know where that is actually. It's in Ireland, is it?
No, that's one of the Caribbean islands.
Is it?
Yes.
Oh, wow.
I know Stuart.
Oh, okay. Jane Esrifi is watching. Very informative. Sari, is it Jehu Apia? I think it is. Yeah, they are all watching. And Isaac Frimpon, Emmanuel Okomensa, Jocelyn Buyoya is watching from Washington.
Oh, that's great.
Yeah, Rachel Amankwa is watching as well. Ikuya Mante is watching. She is in Harlow. Rosie Otu is watching. Helena Kote is in Cambridge. Innocent Mojila, I'm not sure, but she says, hello, Dr. Khan.
That's right, I know him.
Yeah. So Irene is saying, if an individual has an underlying health condition and has to return to work where there could be potential exposure, it's important that she's a occupational health nurse. You see, so it's probably a contribution rather than a question. She says it's important that a risk assessment, will come to that, isn't it? Is carried out. A referral to occupational health is very useful. So she is an occupational health expert. So it's great, and she's a member of RANA as well. Irene, thanks. I know she's a big fan of this show. Kofi Akon, he says quite insightful we need more of these. Good show, Dr. and Mr. Quayson. So thank you all so much for coming. Mr. Albert Achemfo, I think he is a member of Nightingale Nurses. And he says, well done, Winnie, well done, Dr. Khan, well done, Mr. Quayson. We haven't finished yet, but thanks, it's acknowledged. Just keep sharing though, keep sharing, get all the people on board. Providence Grace Ajaman, I really agree with what Dr. Khan is saying. The washing of hands is very important. People are mainly focusing on wearing the gloves and masks and dismiss cross-infection, which makes things worse. So she can't like emphasize that point enough. Hand washing, like to the nurse, is a ritual. And sometimes people are always asking, how many times do you do this? That's why I never have nice nails, but it doesn't matter. So long as I can stay nice and healthy, I have to perform this like a million times at work. And you can't even understate that. So very important, keep washing your hands, keep washing. Let us know this, I think somebody is complimenting the program. Peter is watching Priscilla Dai. I'm just trying to, he says, hello, Dr. Khan, so you must know him. Francis Achampon is one of my buddies. He's watching. Mary Riafe Ajiatu Banguri. So many of you are watching. So tonight has been amazing. And thanks so much. You are all patronizing the show. We need this for our communities. We need this for the Ghana community, for the African community. I think we are probably streaming on an African site as well. So everyone, and with time, we want the sponsorship so we can get everyone involved, because the reflection of this on Ghanaians is probably a true reflection on all Africans and on all ethnic minorities. So I cannot understate or emphasize what we are discussing enough. And from a nursing point of view, I can't even state how really overwhelming the situation was, because when it comes to frontline, I am frontline staff. And it was just really overwhelming. We went, you looked after your patient, and by morning you'll be lucky to keep your patients alive. You know, we really were striving hard. So please, 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 even though the lockdown and everything else is over and the measures are being relaxed, the disease is still happening and the numbers could go up. So be watchful until we get a vaccine that can treat this. We cannot stress enough. So Dr. Khan.
I was going to stress on something that people should not joke with this condition. And because I had it, and I remember there was one particular night that I thought that was it. I was debating, do I call the paramedics?
So can you tell us what symptoms were you getting, Dr. Khan?
I never had a cough.
You never had a cough?
Nope.
Right, okay.
Just the headaches, the chills, the muscle pain, the dizziness. Almost virtually every one of them, the loss of smell, the loss of taste. And then one of the things it does to your circulation, your blood pressure just drops. I mean, when being a medic, I was recording the blood pressure. When I showed the readings to some of my colleagues, they said, but that's not compatible with life. So how did that? And I said, well, it's just grace. But the way that I felt, there are times when you can't even stand up to walk. So,
and that is the danger.
That is the danger. And normally you get to that point after the first week of the condition. If you're living alone, if you're not careful, you're done for. And there's no support at all. You're finished. Because I have my wife and quite a lot of help around me at home.
They didn't isolate themselves.
Listen, I had to find a way to isolate myself. To the point that even as a fit young man, to the point where at some point, even having a bath, I had to sit on a stool. And I'm telling you this. I couldn't stand. That's how weak and dizzy and giddy that I felt at that point. So my message is that, don't joke with it. You joke with it, it would take you out. Now there's something I wanted to mention as a risk factor. If you look through all the ethnicities that are at risk, the Bani ethnicity, almost all of us, for us, part of our culture is social gatherings, church, religious activities and whatever, in close proximity.
We love our numbers.
Whether it's a party or a funeral, barbecue, church, whatever. It is in numbers, hundreds of people in close proximity. I don't think proper hygiene is a strong point, not at all. We would eat anything and anyhow, anytime, unfortunately, sometimes without even washing hands at all. And it is my plea that I love our culture, it's rich,
Yeah.
and the things that we do, but we need to attach a bit of wisdom.
Yes.
Unfortunately for us in this country, we have no choice but to do the job that we do.
Yeah.
We live in somebody's country. Chances are that many of our people are not paid well. That's the reality of the situation. Like somebody said, if I don't go to work, I would either die of hunger or die of COVID. Now you're torn between the devil and the deep blue sea. What do? You step out there and work because the bill has to be paid.
Yeah.
The landlord has to take the
And
money.
it's important that Dr. Kani said
Yeah.
this because our culture, we almost find it difficult to say no or to do the right thing in order not to offend you,
Offend
Yeah.
people, yeah.
right? So we go to places, funerals. If you go to a funeral in this country, in London, by the time you go, they've laid a table and you have to shake
have to shake.
everyone's hands all the way around.
Yeah.
That's an important
Now
point.
you
isn't
can
it?
just imagine.
Yeah, exposure.
We go to church and we hug. I mean, it's one of us.
And
It's
I
part
love
of
it.
us.
It's part of us.
nice.
Yeah.
It's nice.
But I think one of the things that this COVID is hopefully going to teach us
Yeah.
is to be able to say no, and others who are not shouldn't take an offense.
No, they shouldn't. You know, I
You shouldn't
remember
become like, oh, it's compulsory
Yeah.
to shake my hand. No.
one of my tutors in nursing training used to tell us, because back in the day, like when people came in to deliver, have their babies, they were using like the same sponge, you know, to wash the babies, and that was I hope to God that that's not the case now, because I wasn't doing that, and I'm sure a lot of us were enlightened enough not to. But then she said that, look, whenever you take, and that is Sister Bekwe, she's still alive actually, one of our beautiful like sisters who taught us in nursing training, and she used to say that when you go to the ward and you start using the same sponge to wash one baby to the other, tell them, I'm giving you syphilis, I'm giving you gonorrhea, I'm giving you pemphigus. You know, these are the little things that stay with you forever.
Forever, isn't it? Yeah.
And they are very important. And so sometimes, like, I personally, everyone who probably knows me very well will say you are too over the top, like sensitive to like not being clean and stuff like that. Because I see the effect of people getting very, very unwell. And especially in this COVID period, and let me take the opportunity to say this, because one thing that has also affected a lot of people is because they are afraid to go when it gets really bad, to go to the hospitals than to seek help. By this, I'm citing an example of a friend of mine who has been having gynecological problems, and instead of going to the hospital, she was afraid, you know, and she was buying time and was repeatedly talking to me about the symptoms. And obviously from a cardiac point of view, I could tell that this could be disaster. So I told her, she said, I don't want to go to the hospital because of COVID. And I said, your symptoms are going to kill you sooner than the COVID does. You know, so you really have to make your way. And then she gathered the courage. And initially it was scary, but now I can safely say that there are so many measures in place that your chances of getting it there is really reduced. And, you know, there are a lot of
You
things
see,
in place.
when this happened, one of the biggest worry for the community, the DME community, is the undocumented community people. I mean, I remember a conversation in Parliament where one MP raised that on the floor of the House, that people shouldn't be questioned because it was felt that a lot of people were going to withdraw from even seeking help, or because, one, they don't even have a GP, they don't even want to call ambulance, and they could see that a lot of issues were going to come within that area. So what we do say is, look, if you're sick, you're sick. You've got to be looked after. And this is where belonging to somewhere, it could be helpful, because a lot of people can talk to experienced people who can actually help identify some of these situations for them. We need to come to a point where, as a community, we look after our own as well. We look after ourselves. We take things a bit more seriously. You know, these guidelines that are being given, they're not being given for the sake of it. We need to take it seriously. Wear your mask wherever possible, within a proximity where you know you are more likely to be, exposed. And take your hygiene, all the basic things, washing your hands and all the things, take it seriously. But that goes to those of us here, and especially our brothers and sisters and family members back home. I do worry when you see some of the things going on in the social media.
That brings me to more of the questions, and my husband is watching and he says some people reuse their nose masks. Is this a practice you would recommend?
I probably wouldn't recommend it, but you also have to understand how expensive it is.
Yes.
I mean, at the height of the pandemic, I bought a box of gloves. Now, at that time, you know, the supply was short. So the box of masks and the box of gloves were a bit expensive. Now, the ordinary person may not be able to even get hold of it. I remember even getting hand sanitizers, they just disappeared.
Yes, the first two.
Yeah. So
About a month,
if you can imagine that if somebody is finding it difficult to even buy the mask, if they get hold of one, then they will keep it quite well and use it over and over. Now, a dirty mask probably is better than no mask at all. If they have the opportunity to change it, then definitely they will change it.
Yeah, watch it.
You suggest that every day they come out.
I mean, it depends on what. Well, if you've manufactured that at home yourself, then I'm sure the fabric will be amenable to wash and it will stand the test of time. But if it's one of these disposable masks that we use in hospitals, you can't wash and reuse it. And remember that, you see, even when you're using the mask, your hand is touching the inside and the outside.
Yeah.
That's what people don't realize. I mean, if I'm working in clinic, the mask that we use, so by the time I've seen patient 1, patient 2, patient 3, it is quite humid and wet. I have to change it for a new one.
Yeah.
Not many people can afford that. I have it at source in clinic that I can use, so it's easier for me to do it. And again, because I have patient encounters. But the ordinary person who is sitting on the train or tube or has to use it regularly may not be able to afford it.
Yeah, I have so many people saying they can't emphasize the importance of the social distancing enough.
Yeah.
Obviously, with the Premier League starting and everything, you know, like back.
It's almost like back to normal.
This is where our own common sense needs to prevail, right? So
Definitely.
if you are a member of the community and you know that there's a program that is going to attract 600 people in this time of our age and situation, you don't need a scientist to tell you, please, stay out if you can. I mean, I have been all over the place, but since 7th of March, I haven't had any problem. I have decided to cancel everything. But I will only attend to things on Zoom call or phone meetings, and that's it.
Like that.
Everything else can wait. What cannot wait is your life.
Yes.
Definitely,
I mean, and the choice is yours.
I agree.
So with all the politics and all the talks about things are opening, we are not scary. We are just telling you, look, be wise, be vigilant, and think about what's.
But don't you find it strange that the great majority of people who died are from BMA backgrounds? They're the same people who are propping up all this hospitality industry, retail, healthcare sector. The government says it's okay to go to work, isn't it?
Yes.
Who is going to go to work?
Exactly.
Us.
Yes.
Now, this is where I agree with Emmanuel. Common sense is required. And when we come to risk assessment, I do understand, you know, you're living in somebody's land, your opportunities are limited. Sometimes even the confidence to question things is limited. A great majority of our people work in sectors where they don't have a voice. They're just there. Part of the numbers. Are you with me? Even if they raise up a grievance, they are afraid of losing their job, poor reference, so many different things. Are you with me? They've got a family to feed. So what do? They just keep to themselves. Even phoning, one of the things that we noted was that why is it that our people are less likely to seek medical attention? One, they are very busy juggling many jobs. Number two, sometimes I believe that maybe as clinicians we don't help. I'm a GP. Sometimes when somebody phones and they don't speak your language, I can speak maybe quite a few languages, so I can interact with a few patients. But somebody who grew up here may not even understand somebody from Ghana's ideas, concerns, expectations, what it is that they've even come in with. They don't even have the patience within 10 minutes to listen to you. I remember phoning NHS 111 when I wasn't well. Listen, I cut the call off, and this is me, a clinician, talking. I've been to a hospital where the person, I did not even mention that I was a clinician at all, just to see. And along the way, I went with my son, And the way the clinician was treating my son, at some point I had to reveal that, hey, I'm a doctor myself, and I'm not happy with the way that you're treating my son. And when he even queried why I was querying, I raised it up, I escalated the issue with a senior colleague, and I said, I don't like his attitude, the way he's talking down at me. So if he's treating me this way, how would he treat somebody who's an ordinary person from my ethnicity? And later on, he had to apologize for behaving that way. But that is the kind of obstacle our people face. Now, I probably would challenge such a practice. Most of our people would not be able to, because they're not confident enough to do so. And they don't even know the channels or the avenues to raise their concern. And part of the program tonight is actually to tell them that, let's say the government is willing. When they published that review, that report, they did not publish recommendations. And I can tell you that there are several organizations, including the Ghanaian Doctors and Dentists Association, working behind the scenes. We're submitting proposals and recommendations to the government that we need proper
By that
action.
you mean UK government, yeah?
Yes, that we need proper government. The Racial Equality Whatever Committee that has been set up is to implement any recommendations that are going to be proposed. But we need our own people. If you go to work and you know that you fall into the at-risk category, insist on something to be done. Nobody's going to kill you. And if they don't, then raise it up. And I'm sure in this day and age of social media, somebody would take the matter up.
Definitely. So before we carry on, and the risk assessment part of it is very important to me, to do a self-risk assessment. So we will not miss that on the show. We will have to make sure we come to that. But let me acknowledge a few more people. Sandra Saki is watching. And
that's from Canada.
Is it?
That's my sister-in-law.
Oh, wonderful.
Oh, wow.
Yeah, Neil Harris is watching. Francis Amat, if you are watching, that's my friend from back in the day.
Right.
Isaac Hammond is watching, and he's my brother, the one behind me, Pacey. Thanks for tuning in. Dr. Sapia is watching. Jemima Nuchuga, Effie Baden Parker is watching. Martha Nugent says very informative. We need more of these sessions. I really need you all to be watching like this.
There's a shout to Martha Nugent. She's the GNA chair.
She's the GNA, Ghana Nurses Association chair. So keep sharing. I can't believe how many of you are watching out there. So keep sharing. Who knows? I may land some sponsorship deals. We need these things to come on. It's very true
important that you said that, because once people share and the program can be bigger, it's about health. So we need to get it going.
That's right.
So as much as they can share and we can raise something, then we can bring more ideas to the community.
We can bring more ideas. We can think of everything, anything, so long as it affects your health. We are bringing it to you, and you'll be surprised. It's not going to be just about the doctors and the nurses. We will have the patients coming here to share their experiences through diseases. People have amazing experience to share with people. And Dr. Khan, one thing I like so much, I'll carry on with this, but the fact that you even said that I suffered with it, that is just cutting through stigmatization. Because in Ghana, I know ministers denying that they've been to hospital, or the hospital is not a hotel, for heaven's sake. There's nothing wrong with being ill.
No, but the Prime Minister got it. People of repute have got it's no respecter of persons. There is nothing to be ashamed of. That I got the virus, and it certainly doesn't mean that somebody is not hygienic or somebody doesn't eat well or whatever. There's so many different reasons why.
It's a cultural myth.
That's right.
We feel like as if you feel embarrassed to talk about it. Look, this is a pandemic that nobody prepared for.
That's right.
It's come, and everybody around the world is going through it. So there's no uniqueness in it. And people should be bold enough to come out and be tested, because keeping it to yourself is not a solution.
Definitely. So let me carry on with more people. Ijakuma Brefo, you are watching, she's a RAN member. Baba Christian is watching. Thank you, big sis. Evelina Siedu is watching. Gifty Okai, Andrew Chumesi. Andrew, I'll get you here very soon, so get ready.
Andrew is a pharmacist,
It's a
isn't
pharmacist,
it? Yes, that's
so
right. I know Andrew.
get
Yes,
ready,
I know
Andrew.
Ya Jakoma Brefo.
Yeah.
Yes, she's a sister.
Yeah, Abbas, and yeah, said
Yes, Takrade,
it's
yeah.
your sister, isn't
Yes.
it? Yeah, Rachel Siedu, I think she's watching from US. Abbas Ali, he is watching from Kaswa. Abbas, I think I give it to you. yeah, you really made my day. The city of Kaswa, come on. Well done, you. Jacqueline Adebia and Jackie, thanks for watching, but keep sharing. It's not enough to watch. Keep liking, sharing, do whatever you will to get the program going. Daniel Kwaja, Princess Abe, Adeza Haruna, Shelley Osei, Ejekum was my schoolmate, Young Soul, Sandra Saki, Gifty Okai, Cynthia Ackermond, and Rosalind Yoja.
Oh, that's incredible.
Yeah, if you are, I'm not mentioning your name, please pardon me, but I'll do my best to capture everyone who is watching tonight, and I'll say you've been amazing. So we are carrying on because it will be out of order not to look at. Now we know that it is not peculiar to blacks as such. It's just exposure.
That's right. Yeah.
So the more you look after yourself and observe the rules, the better it is for you and for us all, really. Yeah. So
you did ask about treatment. And I'll make it very brief,
Uh-huh.
in the sense that we don't have a cure,
Yeah.
like many other viral conditions. Once you start mentioning things on air,
Yeah.
people stop seeking medical advice and medical attention, and they start buying stuff in this day and age.
Especially in Ghana, where everything is
So normally when
accessible,
I do health programs, I would not mention any particular medication or anything at all. The disease is managed. It depends on the severity. In the great majority of cases, you would see that more than 50% of people recover from it anyway. Are you with me? Simple management, supportive management, plenty of fluids, painkillers if you need to. In our communities, all kinds of things have cropped up since the pandemic. So Bolo and so many other things. People taking their vitamin C, vitamin D. Multivitamins are very good. It boosts the immune system, and certainly as a community we are low in vitamin D. So I would always recommend vitamin.
Is that in Ghana as well, or they are just fine? Is it for those of us who live
No, in
abroad?
Ghana probably they would be fine.
They have
but
enough
we are
doses of sunshine.
enough doses of sunshine to manage. And they don't wear long sleeves and jackets like we do. So we are struggling. We are struggling here. So yes, vitamin D is quite good. I have taken high dose vitamin D over the past few weeks to boost my immunity. The truth is that we're very busy people. We work around the clock. Our weekends are packed. If you're not going to have the time, then boost your health. Do the right things to boost your health as well. Vitamin C is important for the immune system, and certainly good to prevent colds. In terms of other treatments, if you're unwell, speak to your GP. Seek attention. You'll be managed according to your needs. That is all that I would say. There's so much information out there. We don't have the time to talk about it. In terms of vaccines, there are things that are in the pipeline. Most people would be aware that it takes almost up to about 18 months to manufacture a vaccine. So we're not anywhere near a vaccine. I'll be surprised if a vaccine popped up in the next 1 month. Then that would also tell me something, that the vaccine was already in the pipeline a while ago, even before the disease popped up. Otherwise, then, yes, there are different types of vaccine. I would want to know what type of vaccine it is that has been cooked so quickly within a few months.
And actually, a friend posted a publication that they plan to test vaccines on black ethnic minorities.
But watch the space. Whatever is coming out, I'm sure that we would scrutinize it. My personal advice probably to our governments is that we do have great scientists back home, great leaders back home, but whatever it is that is proposed for the sake of our people, they should look into it. Make sure that it's tested and trusted before using anybody as an experiment. If I have to, and I have no problem at all, I'm saying that it is health and lives that we're dealing with.
So we will be looking at the risk assessment.
Yes.
But somebody's nearly strangling me here for not mentioning their name. Evelyn Asiedu. Yeah, is watching. Baba Esekukan.
My wife.
Oh,
Wow.
wonderful. It's watching. She's watching. Joyce Mantia is watching. And my husband is saying that there is something going on social media. Come on, husband. Yeah, saying that people who have severe cases of COVID-19 can release the virus when they fart. Is it true? Apparently, it's going on.
That's probably a myth. I've not. Listen. It's interesting. Some people think that we said alcohol gel 60% kills off the bug, isn't it? So if I drink aperitif, which is absolute ethanol, and it goes into my system, then it probably a president suggested we should probably put DDT in our veins.
Yes, well,
Disinfectant in our veins and kill off the virus, all kinds of things out there.
Yeah, so AC Abraham, Mili Otu, Abba Asma,
Yeah, Millie Otu, yes. That's my sister in Scotland.
Watching, Evelyn Kwenu, Mosh Money. I don't know, that the person knows you, Dr. Khan.
Yes, I know him.
And then Ifwa Amen. Yeah, Abba Asma is saying, on the subject of masks, the use of face covering is better than a mask in public to reduce the infection. Like Mr. Kweson's comment on the undocumented, it is time for the High Commission to act and get all the Ghanaians registered at the Commission. There are a lot of them here at present and need help. I think it's just the issue of people seeking help. And Evelina Siedu is asking, do you get immunity after suffering from the condition? And will vaccines give immunity and prevent you from getting it again?
Interesting. You know what is coming out now is that some people tested positive. And like you're saying, when we started doing antibody testing, and they tested negative. Now, antibody, when you're ill, there's something called antigen, which is what we test for the disease. And then antibody, after you've recovered, the body mounts up an immunity. So when you do the antibody testing, we're looking for signs that either you've been exposed or you've had the disease and you've mounted up immunity. Some people tested positive for the disease. They've had antibody testing. It's negative. That raises two questions. Either the disease does not confer absolute immunity, or that it may give immunity briefly, and then it disappears again.
We all don't know yet.
That's right, we all don't know. Like a lot of, if you take influenza and flu, for example, why do we vaccinate every year? Because immunity can wane. Are you with me? It doesn't confer lifelong immunity. And that then emphasizes that people should not joke. The fact that you've had it before does not mean that you cannot have it again.
It's interesting you said that, Dr. Khan. One of my colleagues on one of my platforms sent me a message yesterday that they went to their doctor and they were told to take COVID-19 pneumonia vaccine. Is it true? And I thought, no, I don't. To the best of my knowledge, there isn't any.
There's nothing like COVID-19 pneumonia vaccine. What happens is that there's a category of people, class of people who have certain conditions. They are at risk of bacterial infection. Pneumonia normally is caused by a bacteria. So there are patients that we give what we call the Pneumococcal Vaccine. Is a type of Pneumococcal vaccine that we give after every 5 to 10 years to boost their immunity. Typical example, for example, somebody with sickle cell anemia, for example, they'll be prone to bacterial infections. So then you give them that vaccine to protect them. Are you with me? So there's nothing like a COVID-19 pneumonia vaccine. But because it causes a pneumonia, maybe the person is at risk of another disease that will make them more prone to pneumonia.
We have a few minutes left, just about 5 minutes left. So I need us to go to that risk assessment.
Okay. Now the risk assessment, what I want to say is that this is not, you told me to do a document or whatever. Now on hindsight, people would think that this is a final document, this is it. This is not a final document because people work in different sectors. So the risk assessment that, for example, will be done at my workplace will be different from the one that will be done for somebody in a different sector. The most important thing is that people should engage with their employer. The government has made it very clear to employers, so many guidance that employers should risk assess people from blacks and minority ethnicities and put measures in place.
Please, yes.
Is that okay? I've put some information together. I'll release that information to you later on, and we can probably make it available. Is that okay? It is just share.
Yeah.
It is just advice as to what people can do, the kind of questions they can ask when they go to see the employer. Like that occupational health specialist mentioned, everybody is entitled to speak to their line manager, supervisor, manager, whatever. Speak to them. Discuss your conditions with them. That, okay, one, because of my ethnicity, I'm at risk anyway. Two, maybe my age. Maybe I'm over 40, advancing in age. Three, maybe weight as well. Four, maybe you've got high blood pressure. Maybe you're on certain medications. Don't hide it. Speak to them. Okay, take advantage of it. They will do a risk assessment with you. They will take into consideration all these factors. And then whatever you do, they have to, one, ensure social distancing. The recommendation is that if somebody can work from home, then the employer should make sure that they work at home. Ask yourself a question. The kind of jobs that our people do, how many of them can work from home? They can't work from home. They have to go out. So if they're going to go out there, they should have a discussion. Speak to your line manager, and they would signpost you to whoever should do the risk assessment for you, and then they put the measures in place. If they don't, they have every right to complain and raise it. Now, complaining is another thing, whether it will be dismissed or not. It depends on what contract you have and the circumstances at your workplace. So people need wisdom to manage it. Ghana Union is doing quite well. I don't know whether there's a mechanism, there's a forum somewhere where people can.
We have an advisory service.
Okay.
Which if you have an issue with an employer for raising genuine questions, and as a result you become victimized, you can come and we can signpost you to specific people who can give you advice. I will also say some of you belong to organizations where there are unions. There are trade union organizations that try and be part of it. So these are some of the things that we don't take it serious.
No, we don't.
Being to a workplace, there are unions there. For the sake of £10 they will take from your wage, you don't want to join. These are times where all these things can help. But we are there. If you come and you need our help, we'll find a way to signpost you. I mean, even yesterday I had somebody calling, looking at how to fill certain HMRC information for, and we were able to guide them through some of these lawyers. People, accountants, and the rest that we do have. And the doctors and nurses have always been great. So thank you for all the support you've been giving.
And certainly, Ms. Chrissy, if there's one message I would want you to give to our communities out there, is that look, the people are privileged. We live in a country where they have access to the NHS. Okay. To me, health is wealth. And I keep promoting this. You don't put the cart before the horse. You put the horse before the cart. Are you with me? If your health is not good, you can't even do all these 3 jobs and 4 jobs and whatever. Unfortunately, I've had patients from our home country who have had poorly managed hypertension and have developed stroke at a very young age. It's so distressing to see. Health is important. Personally, to me, it's more important than money, because you can have all the millions in the world and not have the health to enjoy it.
What's the point being, having the money and
that's
not
right,
being
and
able
not
to enjoy it?
It's simple things. Look, driving a flashy car around everywhere doesn't mean that you're wise or you're great. Listen, sometimes ditch the car, walk a bit more. I know we love our meat, we love our food, we love our cuisine and whatever, but healthy eating is also important. And we shouldn't wait until we can't walk before we start trying to lose weight. And the gym fees are also very expensive, So it is better to start now. Maybe I'm trying to train myself to eat a bit of grass. It's not easy.
Because for the past 3 months, I've been riding a bicycle.
It's you.
I park the car, and that's all I do now.
And you feel much better for it.
So wonderful.
That's the only activity I found for myself.
I think we'll just about round off now.
That's right.
I honestly can't thank you guys enough for coming. You see, this whole program started with just the experiences I had when my mom was ill and she eventually passed away. So especially with such a large viewing. I have to tell you all that it was just my passion, and I never developed it, never shared with anyone. But you'll be surprised how much you get when you share with people the information that you know. So, gentlemen, I cannot thank you enough. Dr. Robert Khan,
you're welcome.
Who is a GP, has been with us, and is Mr. Emmanuel Kwesi. Mr. Emmanuel Kwesi, for just so you know, I started this through your link.
Yes, I'm actually grateful that it's going well. You are doing well. I've been watching you. We want to thank the Joe, and the Omega Live network. That these are the kind of organizations we need. Right? For us to do good to the community, we need organizations like that to avail their services so that we can give this information. If Joe didn't allow this, there's no sponsorship yet. What do you think we're going to do? How are we going to send all this information? So I'm encouraging the likes of Joe and others who have other services to offer.
And I was just going to say that, look, I'm sure there are people that are watching health is important. Certainly, as you said, it's not just health that we talk about. There are so many things that impact on health. If there are sponsors out there, it would help.
Help us.
It would help.
Yes.
Give us a piece of, the millions, so that we can at least educate our people who don't have the resources, maybe to seek that advice. Exactly.
Because you see, these days with this social media, people are actually watching this more. If we were to call a public forum, you wouldn't even get the number of people who are watching today. Right? So it's much faster, quicker, live, interactive. People can actually listen to you from wherever they are.
And take part.
We've had viewers from all over the world, from Canada to Ghana to wherever, Kasua and the rest.
Kasua
it shows that we are actually reaching out.
Absolutely, So, I'm sure I'll have to get you all back here at another time. But my heartfelt, sincere appreciation goes to Mr. Joe Baidu, my producer and chief executive. He is buzzing. He always buzzes when it goes well. So I know you've done a great job today. And to all the crew out there who take part with the activities of Omega Live TV in one way or the other. Post-COVID, we are going to do amazing. We are starting bigger, starting better. But from a nursing point of view, I'm not doing this for fame or for anything. The health of people is very important. The kind of experiences that you will have when you go in hospital, it helps when you have a bit of knowledge.
Yes.
You see, because you only need to start talking and then the person knows, come on, this person knows what they are on about. You need to know. The only way you will know is to ask. And the only way you will know is to get involved in such social activities. So this has been an amazing session, and gentlemen, and I'm so pleased. And I found out at the last minute you are from Tadi.
I'm a Takrady boy.
And Mr. Kwesi is a Tadi.
Oh, that's interesting.
This is an all Tadi show, you know. If you don't know Tadi Takrady, Google. So you will find where it's somewhere in West Africa, Ghana. I am extremely grateful to all the presenters here at Omega Live TV for the support. And Joe Baidu, this is a vision that you want to develop. I need you guys to be sharing, to be liking our page, to be watching. The next time I come your way, there is a gentleman who will be my first guest outside of Ghana, actually. And this gentleman has suffered with kidney disease. And the reason why I really am looking forward to it is when it's Ghanaians, we don't share. Everything is an abomination. Everything is a stigma. This gentleman has suffered with kidney disease from a young man. He has actually had all the treatments that you can think of, from kidney, from dialysis to transplant. And he has won an award even with the Queen for his activities towards social services and in educating people on his condition. It promises to be fantastic, and I can't wait for Mr. Jaja. You will be my next guest in 2 weeks' time when we come your way. Thank you to my husband, Mr. Christian Ohinikisi. I never mentioned your name, but he's the backbone. I can't do this without him. And I need permission. And don't call me at all hours. I'm a married woman. Please Please, yeah. And to all the fans out there, my big sister, my best friend, Nana Sarah Mofa, and all Western Region Association of Nurses UK, to the Ghana Union for your incredible patronage in everything that affects the welfare of Ghanaians. Dr. Khan, I know I'm getting you back here very soon.
Definitely.
Yeah,
I'll be more
so
than happy to
we
come
will
back
be
here.
looking into all those comorbidities, the things that affect our health so much and really breaks us down when we don't have all the necessary information we need. It is one thing receiving treatment and one thing having the knowledge about the treatment you receive. So until we come your way with more episodes, especially on the 10th of July, when I bring Mr. Jaja here, thank you all for tuning in. More people are here. Kofi Kula is watching, and all those who joined in later on. I can't mention your name, but I am really grateful for joining in. I love you all so much, and it's going to be bigger, it's going to be better. It's not for me, it's for us. It's for us. We need to be together for the community. And Archbishop Frimpong Manso, you also started all these live shows. So yeah, Archbishop, I hope you are watching. You should feel proud of me because you got me into this. So thank you so much. And like I always say, look after yourselves, guys. The disease is still around. COVID is still here, and it is not gone yet. Watch out for the signs and symptoms when they come. Yours may present totally differently. Maintain your individuality. If you are sick, you are sick. Seek help. And like I always end, I will say, watch out. Work hard as if all depends on you, and pray hard as if all depends on God. Because no matter what you do, you will need somebody, in a friend, in a family member, or in someone. So take care of yourself, and it's been an amazing session. So thank you, gentlemen, for coming.
Thank you.
And thank you all for
getting us here.
watching. God bless you. And please, I will be coming your way in 2 weeks' time when